How's it going, modern manual therapy followers? I had a recent Q&A from Hannah, who's a TMJ specialist, aspiring TMJ specialist, who recently took one of my modern manual therapy live courses in eclectic approach to TMJ management. And she had a question, a live case. She said, a female in her late 20s with a history of open lock. She has gotten it to reduce each time, but passed out from anxiety while her jaw was an open lock. So she cannot recall the mechanism of reduction. She has significantly limited jaw opening, maybe one finger width. I don't even think she has full range of motion of rotation, zero lateral deviation bilaterally. She has been this way since 2016, very stiff and hesitant for jaw and cervical range, secondary for fear of open lock. She came to my clinic for pain relief. I was fearful if I performed any joint mobs or extreme active range, she would go into open lock. I treated soft tissue of upper traps, masseter, temporalis, suboccipitals. I initiated cervical retractions and very light isometrics for lateral deviation and reciprocal inhibition of mandible elevators. Her questions are what manual treatments or exercises to avoid open lock, and what to do if she comes into clinic with open lock. She said she talked to a colleague who treats TMJ, and she said she had an open lock patient reduce when she tipped her head back into a hair salon wash bowl, aka extreme cervical extension. It's definitely possible. Um, so I think there's several things that need to be addressed here. The first one absolutely is the high fear avoidance. Anyone who has high fear avoidance is you're going to have poor outcomes, manual therapy, all the tricks in the world. Research basically shows, and we all know from experience, people with high fear avoidance typically have high kinesiophobia. She's afraid to move. That's very difficult to treat. You can do all the passive techniques in the world to relieve it, but ultimately, what does she do with that relief? She's got to be unafraid to move her jaw and her head and neck. Just no way to function, especially in terms of eating. One way to really address that kinesiophobia is to say that you don't even have enough motion. Your jaw is so stiff, your head and neck are so stiff that you don't even have enough emotion to open lock anymore. It actually requires probably beyond three finger widths. So three finger widths is what you should really be striving for. That's functional. She can eat and speak and do most things with her mouth. You got to restore that lateral excursion too, to at least I would say 10 millimeters of each side. That way she could masticate properly. I'm not exactly sure what she's eating, if she's breaking up food into really small pieces, or if she even has pain with opening. If her only problem is severe open, she now has closed lock, and she doesn't have any pain. I treated a patient a very long time ago who didn't even have any fear for her jaw, but she was a slow responder. This is going to take a long time. If she actually has severely limited range in all planes of her jaw, and she's been self-limiting for several years, you're going to have to do a ton of tissue work. She's going to have to just basically repeatedly move her jaw, focus on those isometric opening with a tongue through for the mouth, isometric lateral excursions bilaterally, and also lots of cervical retractions and just general cervical rotation range of motion. She can do resisted isometrics, looking to the left, looking to the right. Again, I think one thing to really stress is that she doesn't have enough motion to go into open lock. You can't open lock at the severe open range. It has to be at end range, and we're talking 4 or 5 millimeter or 4 to 5 finger widths or 40 to 50 millimeters of depression. She doesn't have close to that unless she's actually self-limiting with tone. At this point, I would say it's probably not tone, and she probably does have contractures or true issues in the tissues. Once you actually can get your thumb in there, you can start to do joint mobilizations. But again, she may not like that. So I would say all the stuff I taught you externally about the repeated motions and repeated isometrics with opening and lateral excursion is fine. You can do soft tissue work, ISTM. You can teach her how to do her own self soft tissue work to the temporalis masseter in a superior to inferior direction. She can heat her face repeatedly throughout the day to kind of relax that tension. She can do repeated isometric contraction of her mid and lower traps to reduce tension in her upper traps. Um, and I think, again, it's very important for her function and just for quality of life to get it to around three finger widths. I would say that again, being a slow responder, she's probably going to might take months, on and off. You're gonna probably see her a lot in the beginning and then kinda taper off in the frequency. So, good luck, and I hope you found these suggestions, useful. In my particular patient, it probably took, like, 3 or 4 months to get her to maybe 2.5 um, finger widths of opening. Again, it had been maybe over 20 years since she had that much of a loss, and the dentist who sent her to me only sent her because she was now limited. She was so limited, he couldn't even clean her mouth, and that's always an issue because oral health is definitely, um, correlated with overall health. So good luck, Hannah, and keep me updated.